Good afternoon, good morning, good evening to you all. My name is Donald Bundy. I'm with the Research Consortium for School Health and Nutrition, and I'm delighted to welcome you to this first of two updates on the Research Consortium. This first update is going to be called "What is the Case for Investment in School Meals and School Health?" And I'm joined in moderating this session by my colleague, Bibi Giosi. Bibi, can you join me now?
Thank you very much, Don, and thank you everyone for joining this session, which promises to be very interesting between today and tomorrow. My name is Boitshepo Bibi Giosi. I'm with the African Union Development Agency as Senior Advisor to the CEO on matters of nutrition and food systems. Also, of course, around school meals, and I'm on secondment from FAO. Back to you, Don.
Great, Bibi, thank you. And some of you will remember that Bibi and I dealt with the launch of the Research Consortium just over a year ago. So we're sort of reprising that role, and we're going to co-moderate. We've developed this program jointly, so we're going to introduce it together. I just wanted to congratulate the School Meals Coalition for this great week. It's really turning out to be a fantastic set of events so far. This is an area, the school meals area is an area that's of interest to all geographies, all income levels, and the 73 countries that have formed the School Meals Coalition just exactly a year ago created this initiative, the initiative called the Research Consortium for School Health and Nutrition, really to do three things. First, to gather evidence across multiple sectors, health, nutrition, agriculture, and so forth, to be independent, to not be fixed to any particular agency or any particular country, and to be global. And I have to say that being global is probably our hardest task in order to move forward. We'll talk more about that. How have we set this up? Well, here's a picture of the structure we're working with. You've got the coalition countries at the top. That's the boss. We have the Research Consortium's secretariat, a very small secretariat based in the London School of Hygiene and Tropical Medicine. But the real work is done by a network built around existing networks of communities of practice. And it's these global communities of practice that are the key to reaching out. Bibi, I'm back to you about those.
Thank you very much, Don. This week, we are going to be looking at the 4 communities of practice. And let me just add that we have 2 new communities of practice, namely the Early Career and Youth Network, as well as additionally a new COP on diet and food systems, which we hope will take off very soon, as we heard from the previous session around data development, around surveys from different parts of the world. We really hope that we can carry these COPs forward. Now, when you look at what we are going to be doing in the today and tomorrow, we should also be thinking about looking at other events around the related topics, such as Bond Kids, the GCNF session, as well as other, as Don mentioned earlier in the previous session. So if you look at what is on the screen, it gives you a pretty good idea of which sessions you should be engaging with and what outcomes you intend to get, and how, when we finish, by Friday, we should be able to link everything to what we have heard, to what we have seen, and how we are thinking to shape the School Meals program through the School Meals Coalition and the Research Consortium going forward. Back to you, Don.
Great. So, one of the points that Bibi's making here is that we have 2 specific updates from the Research Consortium. There's this one, and there's another one at exactly the same time tomorrow. Those are from the consortium itself, but we also want to highlight these other sessions that are up on the screen, which we see as really important sessions as part of this networking across all the networks that exist. We've just actually had one, but it's still recorded. This is one about about nutrition as a global event. But we also have others coming up that that BB was speaking about, and then on Friday we hear from two of the other initiatives that are part of the of what we're doing here. But I also wanted to say that that we have created also a new statement of the main insights we've gained over the course of this last year. So those of us in the consortium have been sharing information about this. This is to become the anchor document for the coalition discussions, which are going to go on in Helsinki next week. And what we wanted to do was share this with you now, all this week, to allow time for you to offer some suggestions, some feedback, we hope, through the Q&A during the course of the sessions. So you can view this on our website. It's going to be discussed next week, and feedback from all and any of you is more than welcome to help us move that forward. Okay, I think...
Don't let me just push you a little bit here. Can you just explain, or rather, give some insights as to why we only have 73 countries? It's not even half of the global country networks that we'd like to really engage with. I mean, how are we going to be instigating to get more members to sign on to this statement and to be really a part of the School Meals Coalition and the Research Consortium? Over.
Okay, so the 73 countries are, of course, the members not of the not simply signatories to a statement, but these are the countries that have committed to invest in school meals going forward. So this is the 73 countries of the coalition, and I actually think it's amazing that within 1 year, 73 countries have stood up to do that. I also think that one of the most extraordinary things is the diversity of this group. So we've got 30 countries from Africa there, but we've got the US, we've got China, we've got Cuba, we've got countries showing the whole gamut of levels of interest and levels of income. So I think this is great. And of course, I can emphasize that we also include in that the European Union and the African Union as groups. So the statement is much more about thinking, trying to have thought leadership, which we all can take part of from a global point of view.
Wonderful. Thank you, Don. And this is a really great progress. I mean, since the consortium was started last year, about 1.5 years ago. And so I think we're on the right track. Now, without further ado, ladies and gentlemen, dear participants, let me say we are honored to introduce Professor Michael Kremer, the 2021 winner of the Nobel Prize for Economics. Michael has worked in a whole range of areas, on issues of health and education for most of his career, and starting as a teacher in Kenya. That's interesting. So I think you have more insights around, what's the difference and what are the similarities between the different countries and different continents. So he's going to be setting the stage and painting the context for us as we move forward into this session. So Dr. Kremer, Professor Kremer has 20 minutes to deliver his message, and we really look forward to it, and welcome Professor Kremer. Over to you. I hope he's in the room already.
I think the demons of
technology.
Demons of technology have got us, and I'm wondering maybe then if we can just if our colleague Professor Stefan Verge would mind stepping up. Oh no, sorry, Stefan will be speaking, but after Michael. And I can see now that Michael has indeed joined us.
Welcome.
So I'm going to pass back to you, Bibi. You can, because I'm not sure
Thank
Michael heard you mention that he was teaching in Kenya before he.
Kenya.
Yeah.
Which is very exciting. So I was just saying, Michael, before you came on board, that will be very interesting to hear your perspectives. I mean, especially that you've worked in Africa and other parts of the world. I mean, as you deliver your contextualized remarks, to get us to understand how moving forward, we can have also a south to south, north-south collaboration and sharing of practices. So over to you, Professor. You have 20 minutes.
Thank you so much. Thanks for the question. I think you mentioned south-south to collaboration and the perspective of somebody who's taught in school. So maybe I'll try to touch on each of those issues as I go through this. I'll improvise a bit from the slides. I'll try to share my screen here.
And I'd also said earlier on that Michael was part of the launch of this research community as well. So this is good for us to have a, as it were, a check-in after a year. Are we? Is the screen sharing?
I'm just there we go. Let's see if this is successful.
Should be.
I
think it should be.
It's maybe a slightly different version than I was used to. I'm sharing my second screen. Maybe I should move. I'll tell you what, I'll try to move.
If not, does IT have Professor Kramer's
there we go.
slide deck? Okay, perfect. Thank you.
Great. Okay. Thanks very much, and sorry for that slight delay.
Oh, I think, have we lost Michael now? Is that frozen?
It seems to be frozen. Professor, can you hear us?
Days of life to something which is much
Yeah, his screen is clearly frozen. I don't know if IT can intervene. Sorry about that, participants. The gremlins of technology always get us.
Mm-hmm.
just
Don, as we are trying to sort out this hiccup, can we maybe move to Stefan and then come back to Professor Kramer in the interest of time?
Yeah, I think that's absolutely what we need to do. So, Stefan, can we take? Can the system please bring Stefan up? Can we spotlight Stefan to So Professor Stefan Verge from.
Are we reconnected?
It now sounds like we're hearing you, Michael. For some reason we didn't.
But your screen seems to be frozen, Michael.
Okay, team, can we can you give me some advice on the IT side as to what we need to do now? Because we can bring Stefan in to speak if we can't get Michael. Stefan, I hope you don't mind
sure,
jumping.
Not a problem. Not a problem at all. Good morning, good afternoon, everyone. So I'm delighted to be here, and let me share my screen. So here we go. So what I'm going to speak. Let me do. All right.
I always think these are great labor-saving devices that cause us so much extra labor. There we go. And this is Stefan Verge joining us from Harvard, who Stefan is part of he's a co-chair of the Analytics and Metrics Community of Practice, and he's going to talk to us today about the studies where he's working with several countries now on value for money from school health and school meals programs.
Right, and so then all right, so I think you can see my screen, right? Everything okay?
I'm not seeing anything yet.
Not yet.
I don't see it.
Tell me when you see the...
Yeah.
Stefan, would you like us to display your screen, your slides?
If you'd like, if you want to show the slides.
Okay, let me give it a go.
I'm going to try this.
Okay, I'm seeing slides now. It's, yeah. Oh, now it's gone again.
Sorry, were you able to see my screen?
Nope. We saw it
Okay.
temporarily, but then it
Then it
vanished.
disappeared.
Okay, let me try again.
Now we can see it.
Okay, and I think you're seeing mine.
Okay, we're seeing somebody's anyway.
This is
Okay,
Stefan's
so-
screen. Yes.
Okay.
Go
I
ahead,
can
Stefan.
see it full screen. Is that good?
Yes, we can
Okay,
see your
great.
screen now.
All right, so great to be here with all of you. And what I'm gonna, as Don was saying, is I'm gonna present in a snapshot a little bit of work that we've been doing as part of the Community of Practice of Analytics and Metrics and issues of value for money of school feeding investments. And I'm delighted here to be joined with my dear colleague, Albert Saka, Chief Education Officer in the Ministry of Education in the government of Malawi. What I want to start to say is that the first thing I will mention is that, which I'm saying the obvious, I think that everybody on the audience is convinced, is that we have a unique opportunity for effective impact via schools. If the learner has an improved health status, then there's better educational attainment, there's better learning. Conversely, with higher education levels, there's better health outcomes, improved health status. Also, school children shape long-term habits and health behaviors. In particular, we can think of good habits regarding dietary intakes, the prevention of consuming too many sugary drinks, harmful product, and so on, which will have long-term impact over the lifetime of these children, preventing eventually very costly non-communicable disease treatment and so on. And then I always say this, which is the obvious, is that we always say in health or in the health sector, we always have a trouble finding people, but there's a place where we can find people coming every day. These are the schools. And that there's an opportunity here with health intervention being able to be delivered via schools, reaching millions of recipients indeed. The second thing I wanna state here, and which really builds on a stream of work of many people, in fact, in the audience, is that there's really a multi-sectoral impact of school feeding programs. That by investing in school meals, school feeding programs, I can really have many impact across different sectors. On the one hand, obviously, in the health and nutrition sector, better dietary intakes, better healthy behaviors, as I've mentioned, which means a lot of burden of disease averted, potentially, okay? Secondly, a learner being healthier learns better. And so there's potentially great substantial educational outcomes, better attendance, better academic performance. Then also by providing food security, by providing some sort of income transfers to families, I'm able through school meals program to bring social protection to families and households. And then lastly, there's evidently through the development of homegrown school feeding, there is the potential to develop the local agricultural economy, to develop local food systems, to create jobs for farmers, and perhaps eventually to create stable markets for farmers to sell their products. So that eventually, and this is really the sort of scope of work that we're leading on in the Analytics and Metrics Committee of Practice for the Research Consortium, is that thinking about value for money, we are really thinking about identifying the best buys across those multiple sectors, that for given health education interventions, which would be delivered via school platforms which have a certain cost, then we would have these multi-sectoral impact returns: health and nutrition, education, social protection, agriculture. And then within that, there's also potentially very strong equity impact, perhaps being able to really reach the most marginalized and the most in need students, as well as potentially a strong gender impact, which is very much in the conceptualization of the work we're leading on in that committee of practice that we really want to document. And so far, we've found with a global model that we find very high returns potentially of investments, with returns of around $10 per $1 spent in these multi-sectoral impacts. And lastly, what I wanted to point to is that we do have a number of ongoing value for money studies, and where you can see here focusing on Sub-Saharan Africa, with many countries being involved or about to be involved. And then really with this commitment to establish strong collaborative partnerships, including evidently at the national level with national governments, the World Food Programme, as well as really very importantly, the peer learning through the involvement of regional institutions, the African Union Development Agency, the Southern African Development Community, as well as ECOWAS in Western Africa. So I will stop here, and then I will give it over to my dear colleague, Albert Saka, who will detail to you the vision of the value for money assessment work in Malawi. So Albert, over to you.
Thank you, Steph. Are you able to hear me?
Yes, very clearly, Albert.
Yes, we can.
I will display the slides for you if you tell me when to move the slides.
All right, thank you so much. So,
Stefan, can you put the slides on full screen, please? I think Swap Displays does that, doesn't it? Something like that.
Yeah, along the top, Stefan, where it says Swap Displays.
All right, should I proceed?
Yeah.
All right, thank you so much. So I'll take you through what we do in Malawi as part of as one of the countries that will participate in the value for money study. So I'll just give you a brief of what the School Health and Nutrition Program is all about. So in Malawi, through the Ministry of Education, we are able to implement a School Health and School Nutrition Program after the government observed the need for school health and school nutrition amongst the learners. Then they created a department within the Ministry of Education, which is Department of School Health and Nutrition, in collaboration with the Ministry of Health, to be able to coordinate the School Health and School Nutrition Program. So the main mission being that schools in Malawi should be able to able to provide health and nutrition services as an integral and sustainable part of the education system in order to build a healthy foundation for the learners. So we have a number of our programs. We have WASH programs, behavior control, vaccinations, and malaria programs. In terms of nutrition, we have adolescent nutrition, we have deworming, etc. But one of the major programs within the school nutrition program is the school meals program, or rather school feeding, which is mostly done in public schools. So at the moment, in terms of reaching out to schools, we are reaching out for 30%, and we're able to reach 57% of all our learners in our public schools. But one of the important things to note is that we have multi-sector collaboration, which is very strong, and this creates an opportunity for us working together and making sure that we do the value for money study in the country. However, in terms of the challenges, one of the major challenges that we are facing as a country is that we have a shortage of finances. We have, at the moment, we're able to reach 851 public primary schools, but our aim is to make sure that we reach all our schools, which are more than 5,000. But also some partners like the BFP, who have been operating for so long, scaled down in terms of operations, reaching a number of schools due to finance shortages. And also recently we have been faced by a rise in commodity prices, which has impacted much on the procurement of the food that we feed in our learners. But also the COVID-19 pandemic really brought us backwards in terms of resource reallocation. The other challenges in terms of climate change, for example, in most of our schools, we're using wood as a source of energy, and this for sure has an impact on deforestation, as you know, wood is a renewable source of energy, and this leads to climate change. And the other thing has been the high cost of alternative energy sources. We'd really like to go use solar, but at the same time, solar energy is really expensive. But also one of the models that we use in school feeding program is the homegrown school feeding program. But this approach has been faced by drought, floods, and pests and diseases, but also what have safe and resulting into reduction in terms of food being provided for our learners. Lastly, we have an inadequate infrastructure in terms of classrooms. Those where we implement school feeding program, we have a lot of the enrollment increases and we have more learners coming to school. And this creates a challenge of having more water sources and also more toilets to assist into the programming. And therefore, the value for money study is really something that is of extreme value, really valid, and would really like to conduct the study in the country. The good thing is that at the moment, Malawi has we have the political will in safe and different programs, but also we also already have a task force in place which comprises government institutions, but also different partners. So the country is ready to work with Stefan in the group to do this value for money study. Thank you.
So thank you very much indeed, Albert, for that insight from the Malawian perspective, and also to you, Stefan, for the insight from the other 11 countries that are now also doing work on value for money studies. I'm happy to say we've reconnected with Michael. So let's give it should we give it another go?
Let's do it. Okay, I'll try sharing the screen again.
I think this always gives us a sense of the realities of distance and relying too much on technology. Perhaps I'm speaking too soon.
Okay. Sorry, bit of a problem here. Further problem.
I wonder if you could just hit the high points of the of your talk, Michael. I'm just conscious that we're
Yeah,
gonna,
yeah. A fair amount of it is in the figures. But let me see what I'll do. I'll switch to that if I don't get this working in a second.
Okay.
Michael, I have your slides to hand if you want me to try to share my screen instead.
No, that's okay. Thanks. I've been editing them. Okay, well okay, there we go. I think it's now appeared. The wrong version has appeared, but I'll tell you what, I'll just talk through as was suggested. Just using my notes. So am I sharing the screen now? That's okay. Let me just stop the share.
I stopped the
able to
sharing. I stopped
Wonderful.
the sharing.
Okay.
You can go ahead.
Great. Okay. So as I was saying before, there's been an emphasis on the first 1,000 days of life, and a lot of very useful things have come out of that. But there's also some people have argued that health investments after the first 1,000 days, but still in childhood, may not have that much impact, may not be able to make an impact. And I think what I'd like to do today is first discuss an area where I've done research, which is the case of deworming, which I think indicates otherwise. And then I'll briefly discuss a few other areas that I think are very promising areas for investment in school health. I'll focus on the school health side rather than the nutrition side, just because that's where I've done more research and I'm more familiar with the literature. So the area that I'd love to, and perhaps you could, there might be one slide where I might ask you to bring something up. If you could bring up the meta-analysis slide when it comes up, that would be great. So starting with the case of deworming, as background, 1 in 5 people globally are infected with intestinal helminths. And these are mostly soil transmitted helminths rather than schistosomiasis or bilharzia. And the World Health Organization recommends school-based mass drug administration in areas with more than 20% prevalence. Why do they do that? Because testing at the individual level is very logistically complicated. It involves getting a stool sample. It's very expensive. And then following up with people afterwards is very difficult. So it's in many circumstances, it's not practical to do individual testing, but because these medicines have been used very widely, both in humans and in animals, where they're often used for livestock and in very large quantities, these medicines are very inexpensive. So while the testing is expensive, the medicines themselves are very inexpensive. And there's so much experience, they're well known to be safe. So the World Health Organization recommends, depending on prevalence, either treatment twice a year or once a year in schools. And this is done in many places, and it's typically done as part of school feeding programs, but there's still large parts of the world where humans who have helminth infections are not being treated, even though livestock in many parts of the world are. So a clear, I think this is a justice issue as well as a health and education issue. But let me start out. Let me stop editorializing and turn to some of the evidence. Do you think you might be able to share the meta-analysis slide?
Yeah, give me 1 second. Yeah.
Great. So I'll put up a slide. I'm going to go chronologically. I'll start with the short run evidence. The first impact that one might see is on just worm load, and it's this is a lot of evidence on that this kills worms, although but then what other impacts we might see impact on weight or height or middle upper arm circumference. I'm going to just show this slide shows what's called a meta-analysis. It combines the results of many different studies, and in the I don't know if it's possible to go to slideshow so we see the full slide, but anyway, I can explain it from here. Okay. Sorry, this shows the notes. Could you go back to the previous way you were displaying it, and then I'll be able to read it?
Yeah, I'm sorry. There's it's
no problem.
Possible to
The first panel, I'm just going from memory, shows cases where prevalence is less than 20%. And these are areas where the WHO does not recommend mass drug administration. And you'll see, great, we can use that. And you'll see there that there's each row here represents an individual study. The diamond represents combining these studies in a meta-analysis. And you'll see the first diamond, in the cases where prevalence is less than 20%, that the point estimate is positive, but the confidence interval, if you go out to the edges of the diamond, includes 0. Okay. Now, then we can look at the cases where the WHO does recommend deworming. These are cases where prevalence is greater than 20%. And there, if you aggregate those up, you'll see a much smaller diamond, the second diamond on the page. That's much smaller because the confidence intervals are much tighter. And there, the estimate is clearly very positive. Okay. If we aggregate this up into all the mass drug administration trials, you get another estimate. That's the third one. On the fourth one, this is the estimate you would get if you assume that the effects are only being driven by infected children. If you assume that treating an uninfected children doesn't do any good, but treating an infected child might have an impact, these would be the implied effects. But you can see that the effects are clearly positive in these cases. And then the bottom is those studies where there's actually been where testing was first conducted, and then population of kids who were infected was identified, and then there was treatment within that population, and there you get it's an even larger estimate because all of the kids are treated. The confidence intervals are wide because there's only a few studies there. So this is the first check, if you will, the impact on weight. We've also looked at height and mid-upper arm circumference, and you see similar results. And if you do a cost effectiveness analysis on this, it turns out to be very cost effective as well. Okay, I can just return to my my notes here. Oh no, I think I will need a couple more slides. Okay, let me turn to the question of the educational impacts. We can stay on this slide till we need the next one. So we examined an NGO program in which deworming was extended to 75 schools over 4 years. And the order of phase-in was determined randomly, or quasi-randomly, by alphabetical order. So counting off 1, 2, 3, 1, 2, 3, 1, 2, 3. That makes it possible to compare the impact of early treatment to compare after 1 year. You can compare the schools that have already been treated to those that haven't. After 2 years, you can compare the students that have been treated at that stage to those which haven't, et cetera. And there we find we focused on education benefits in that case, and we found a huge reduction in school absences. So about 1 in 4 cases of school absence was averted through deworming. And earlier I was asked about my experience as a teacher, and having taught in this area, this is in Western Kenya. This was a time when there was a lot of HIV. There's malaria. Deworming. I'm not going to argue that worms were the biggest health problem by any means. HIV and malaria are obviously much more serious, but the general reaction of students was very positive to the students and teachers and parents, and and we can see, in fact, that there was some substantial impact on school absence. We also found that there were benefits, not just for the children, because this was a mass drug administration program, and helminths are spread in large part by school children through defecation and fecal matter getting in soil, we saw that there was benefits not just for the children who were treated, but for other children in the schools. So girls over 13, at that point, it's now WHO now recommends treating them as well. But there were, earlier it was unknown whether there might be effects on pregnant women. So they weren't treated during this study, and we nonetheless saw reductions in worm load among that group, and we saw improvements in school attendance. Similarly, for schools nearby, happy to, I'm summarizing. We initially had the radius of this effect off due to a programming error, but the result is robust to that. It's a slightly different distance that we found. Okay. Later, Owen Osier did a separate study in the same area and found that younger children in the same region seemed to have benefited as well. And whereas we found gains in school attendance, but no cognitive gains, Osier found among the younger children some cognitive gains, consistent with the idea that there might be somewhat different pathways for impacts depending on child age. Okay. But let me return to the story of what happened with following this population of school children. So we saw these educational impacts in the short run. As we followed later on, we saw gains in entering secondary school for girls, gains in primary school graduation. And then later we followed these students into the labor market. And there, at 10 years, we saw substantial gains. Some kids were, I've seen a question for the reference. This, for the labor market gains, you can see a paper called Worms at Work. That was the 10-year results, and then that's in, and then I'll show a more recent reference in a minute. We recently published an article in Proceedings of National Academy of Sciences on the 20-year results. I should say that even with the 10-year results, the rate of return to this as an economic investment was extraordinarily high, and so high that not only were there very large gains for individuals, but the tax revenue, the extra tax revenue the government would collect would be sufficient to pay for the cost of the program with interest. Maybe we should go on to the 20-year gains, and I can illustrate this. If you, and I think that will have the reference as well. When you go on another slide, that should be a graph of some sort. Yeah, the gains were about 13 or 14%, depending on how you measure it. Okay, so this sort of shows the return on investment. So there's some initial period of costs of deworming. Since more people are going to secondary school, you can debate this, but we put it in some additional costs for hiring, the additional costs of hiring teachers if more people are going on to secondary school. So these are the costs of the program, but then eventually benefits start kicking in. Maybe we could go on to the next slide. So what's shown here with the dotted line, this is the earnings gain that would be required for this program to have a social rate of return of about 10% per year. Note that the costs here are quite modest because deworming medicine is very inexpensive, and even with delivery, it's fairly inexpensive. It would be even cheaper with the national program, but this was an NGO program. Okay, so this is this gray area with the dotted line shows what would have been needed to get a 10% return. 10% returns a very good rate of return. We'd be lucky to get that on our investments. But let me show you. If you go to the next slide, I can show what the actual return was. So if we in our 10-year survey, we measured earnings. We didn't have the resources to measure consumption, but our estimated earnings gains were far, far above this level. And that meant their implied social rate of return was 40%. And then in the 20-year survey, we also collected data on consumption gains. We don't have that for the early period. You know, we're discounting. So the implied social rate of return with the consumption data turns out to be fairly similar to that with the earnings gains, just because we only have data on that later on. But you can see that these gains dwarf the costs. I mean, the cost of delivery, I think, depending on context, 50 cents, $1 per child per treatment. Okay. This
Mike,
on the left.
And try
yes.
to decompress and to just wrap up in the interest of time. Yeah. Thank you.
Okay. Sure. Sure. Let me just see. Maybe what we can do. Why don't I skip the rather than go through some of the other areas, I'll just mention them briefly. This shows, I think, the possibility that, or at least as a counterexample, let me put it that way, to the idea that investments, school health investments, can't have substantial impact. This is something that clearly pays for itself as an investment. I think bringing this type of evidence to ministries of finance, to places like the World Bank, has been very has been helpful in the expansion of the program. There's a question about South-South cooperation. So based on these results, we shared these results with both the Ministry of Education, the Ministry of Finance, the World Bank. When Don was there, the World Bank decided to help make introductions to the government. The government decided that it was going to scale this program up nationally. So Kenya had a national deworming program, and then later, Indian states were very interested in this as well, and a Kenyan, Charles Mwandawira from Kenya, who was involved in the Kenya scale-up, traveled to India to help Indian states learn how to implement this. So this is a case where South-South cooperation was really very instrumental and key. Indian states started to adopt this, and eventually the national government in India has adopted deworming. So that's obviously, that's reaching estimated, well, the estimates are, well over 100 million children a year. The Indian government's estimates are higher, but I think we can conservatively say that. So I think this is an example of how, of the impact of this type of evidence on economic impact. I think there's other opportunities in whether it's in mental health or whether it's in hand washing, whether it's in addressing air pollution. There are a lot of areas where we can try new school health approaches. We can refine those based on evidence. We can document the impact, and I think that has great promise for the future. Thanks very much.
Thank you so very much, Michael.
Thank you very much, Michael.
Yeah.
And thank you for also highlighting and hitting the nail on the head around the fact that, the first 1,000 days are important, but what about the next 7,000 days? And also noting that, deworming, the return on investment, can be quite huge, so that we are not feeding the worms, rather we are feeding the children. Let me just move right along, and participants, this presentations will be made available on the website later. So let me just go to the next two presenters, one from GSA, Poppy Lamberton and Sumrana Yasmin. Can I just ask you to be very brief in the interest of time, keep it to under 3 minutes if you can, hit the highlights, and then your presentations will be shared. Over to you, Poppy.
Brilliant. Thank you. Can you hear me okay?
Yes, we can.
And if I share that, can you see it in presenter mode or in?
It is on presenter mode, yes.
So you can't, yeah, I mean, I don't have notes there, but you can't see the notes.
It looks good, Poppy.
Okay, perfect. Thank you. All right, brilliant. Well, I am delighted to be speaking to you today. Yeah, so I'm just worried because of the previous thing. You can see the GSA, right?
Yes, we can.
Okay, perfect. So I'm delighted to be speaking to you today. My name is Poppy Lamberton, and I'm a professor in global health at the University of Glasgow. And I'm joint co-chair of the Global Schistosome Alliance Research Working Group alongside Dr. Justin Nono-Comgwep. Today, I am speaking on behalf of that Global Schistosome Alliance, so commonly known as GSA. Schistosomiasis is often called bilharzia or snail fever, and it's a debilitating disease that, can you see? Yeah, that's caused by blood flukes and which is transmitted in freshwater snails. And this predominantly happens in areas with limited safe water and sanitation infrastructure and access. And here you can see a picture of a prime sort of transmission site in Uganda. The current estimates suggest over 200 million people are infected, and the vast majority are in Africa. Unfortunately, the COVID-19 pandemic had a major impact in delaying or halting control programs dependent on mass drug administration. And for schistosomiasis, that's dependent on a drug called praziquantel. By necessity, obviously, country health budgets with limited resources directed their control to the pandemic. And in many regions, school closures left children without the drugs that they need, but also without some of the school meals that they provide. And also a lot of the drug programs are administered through the school program. So with people not actually being at school, they weren't then getting the drugs through that way as well. So one of the things that this caused a huge delay in the momentum of the WHO NTD roadmap goal of eliminating schistosomiasis as a public health problem. First of all, we need to respond by increasing our efforts to this, and we're in a strong position to do so with a huge donation of drugs of up to 250 million tablets a year from Merck, KGaA, because there's two different Mercks. And we believe that much more can be achieved by additional interventions, such as snail control, behavior change, but also improve water and sanitation to reduce the risk of transmission. But there's also things we can do just improving the child's health, and this is where it links with the school meals. Many of the morbidities associated with schistosomiasis, such as liver malfunction, bladder cancer, genital schistosomiasis, develop later on in life, but the majority of people are infected really heavily early on in age. And praziquantel is therefore commonly administered to school-aged children, but it does require a healthy immune response to work. And a well-fed child is more likely to have a healthy immune response. And also some of the work that my team has done, separate from the GSA, has shown that in some areas up to half of children arriving at school haven't had breakfast that day. So it is really important when they get fed at school. And so linking child and school health with nutrition is vital. Now, 70% of people live in sub-Saharan Africa. People who live in sub-Saharan Africa are under 30 years of age, and about 42% of them are under 15. And this growing young population means that there's amazing potential for economic growth and innovation, but also that we really should be prioritizing those people for adequate health and nutrition. I know I'm preaching to the converted here, but there are so many families that are living below the international poverty lines, and school meals are a key way to support the nutrition of the growing young population. In addition to using the school platform for the delivery of the administration of drugs, obviously we can also use that for the administration of these meals that you are all contributing to. The health of a child impacts on both school attendance and performance, and a child free of parasites is in a much better position in terms of health and well-being. And combining deworming with free school meals can help improve the health of this huge proportion of the population and the next generation of economic earners. And the GSA obviously strongly supports the work being done by the School Health and Nutrition Research Consortium, and together with the School Meals Coalition, and we very much look forward to future collaborations.
Thank you very much, Poppy. Without further ado, let's jump right to Simrana. Yasmin, over to you.
Thanks so much. Baby, do I still have 3 minutes?
Yes, you do.
Okay. Can I request someone from the tech to share my slides, please?
Yes.
Thank you. I'll start. Hello, everyone. I'm Simrana Yasmin. I am Deputy Technical Director for Sight Savers, who is a member organization for International Agency for Prevention of Blindness. IAPB is the global alliance for the eye health sector, and we have 180 member organization in over 100 countries. And the goal of this organization is to make sure that everyone in the world have universal access to eye care, and child eye health is an area of focus for us. Next slide, please. We all know that eye health is essential if we want to achieve the targets of Sustainable Development Goal. Good vision and eye health unlocks people's potential to get an education, be economically productive, and maintain overall well-being. Next slide, please. So data from various reports tells us that there are 448 million children across the globe who have refractive error, a condition that can be addressed with an eye examination by a qualified eye health professional and a pair of glasses. And then there are over 90 million kids with sight loss. These numbers are huge, and they'll continue to increase due to various factors across the globe. Next slide, please. There is ample evidence showing that good vision improves education opportunities for our children. A study in China highlighted that the use of eyeglasses can reduce the odds of failing a class by 44%. And a recent study from the World Bank indicates that children with visual impairment are 2 to 5% less likely to be in formal education system, particularly in context of low and middle income countries. And more research is in progress to generate evidence in various settings. So we believe that it's high time to do something about it. Next slide, please. The good thing is that there are evidence-informed, cost-effective, proven solutions already exist. The school eye health programs supported and implemented by us and other member organizations are designed and implemented within the existing education and health system. And this includes working with governments, civil society organizations, private sector, and communities. And within governments, we are not talking about just ministries of health and education, but there is a very huge focus on engaging with ministries of finance to make sure that the right resources are in place for everyone. Most of the program utilize schools as a platform to deliver health intervention using eye health and vision screening, deworming, and screening of hearing impairment as entry point. And there is also a very significant focus on a structured social behavior change through awareness raising and building capacity and advocacy for integration. And this then helps us to create a foundation by which countries have awareness, capacity, operational and technical resources to include school health and nutrition into their education sector plans. Next slide, please. However, all of us know that this depends on how sustainable the overall approach is. So the financing model varies as it can be very context specific, but primarily we focus on multi-sector approach to financing so we can support delivery of health and education outcomes. The budget impact analysis and cost effectiveness studies in Cambodia, Ghana, Liberia, and Pakistan has helped us generate evidence on cost of including eye health in integrated school health programs and shows that school-based eye health programs are cost-effective intervention. Alternative financing models like blended financing, joint health and education resourcing are also considered to further ensure sustainability of these interventions, because we won't be able to meet the future child health needs unless there is a commitment towards significant investment from all stakeholders. Thanks. Back to you, Preeti.
Thank you very much, Simran. John, it's over to you.
Dawn, you're muted.
Dawn, unmute yourself.
Sorry about that. I'm going to go straight over now to Veronique Sora, who's going to talk about the Sustainable Financing Initiative, which is one of the latest initiatives to be created by the School Meals Coalition. Veronique.
Thank you very much, Dawn. Can you share the slides, please? While I'm presenting myself, Veronique Sova. Yes, I'm the Strategy and Partnerships Lead of the Sustainable Financing Initiative of the School Meals Coalition. And this initiative has been set up next slide, please. And I will be very brief to explain the SFI because we are running short of time, but I warmly engage the attendees to join the SFI session of the School Meals Coalition, which will happen on Friday on the same time slot. But just in a nutshell, to say that the research consortium is really focusing on elaborating evidence on the why there should be investment in school health and nutrition programs, and what to do, as has been illustrated by the speakers before. The Sustainable Financing Initiative is really focused on how to suppress, to alleviate the financing bottleneck for expanding the school meals program, particularly in the poorest countries. And the objective of the initiative is really to identify financing mechanisms at domestic level and at the international level to provide some long-term sustainable financing for school health and nutrition. And we do that by some analysis work to explore the solutions that have already been tested in a range of countries, and also by going a bit more deeper into innovative financing options. And we also work with a limited number of countries to help them develop a financing strategy able to back up their school health and nutrition strategy. And of course, with all this work, we are working closely with the Research Consortium. Next slide, please. Oh, that doesn't matter. You do not have the other slide. But in very quickly, I could say that we have worked with the Research Consortium during the springtime to elaborate on a memo for the Global Education Forum in April, a memo to build the investment case for school health and nutrition. And the SFI, based on the 7 case studies that we did this year, has been able to provide insights on financing options based on the context of the countries. The SFI is also very much using the LAYS and value for money studies that Stefan presented earlier, because these results showing the rates of return of investment in school health and nutrition are key to set the ground for more investment for governments, but also for international donors. The SFI also joined the Good Examples community of practice from the Research Consortium, and we collaborate on the costs and resources template of the country narratives. And we also hope to collaborate later when all this data will be gathered on the analysis of the data. And finally, I just want to mention that one member of the Research Consortium has joined the Sustainable Financing Initiative Steering Committee, and that we warmly welcome him. So I will stop here. Please join us on Friday, and thank you, Dawn, for inviting the SFI in your session today. Over to you.
Well, thank you very much, Veronique. And apologies to everyone watching this this event for our clear problems with the IT side, but I think the essential message about the case for investment was well made. First, hearing from Stefan and from Albert about the school meals value for money, then hearing from Michael about taking a more broader school health view, and remarkably coming up with this observation that the tax alone paid by the better educated individuals was enough to cover the costs of the programs. It's starting to give us some granularity here. Then I want to say thank you to Poppy and Sumrana for really clarifying this issue of how we need to operate at scale here. We need to operate at the scale of the problem. There are 450 million children need eye vision correction. There are more than 200 million that need schistosomiasis treatment. And then finally, Veronique's very nice piece about how the Sustainable Financing Initiative is starting to look at the details of how countries can respond to that. I'm going to ask Bibi to finish off for us, say the last word, and we look forward to joining with you tomorrow when we hope we will have fewer IT challenges. Thank you very much.
Thank you very much, Dawn, for concluding very nicely with the key messages and key outcomes highlights from our brilliant panel of speakers. Thank you all. And just to reiterate that, you know, if there are still questions in the chat and the Q&A, we are willing to address them through our emails. I hope the organizers can put our emails on the chat or the Q&A boxes so that we have those questions, and then we may try to just highlight some of the outcomes of today as a segue into tomorrow's session. So once again, I wish you all a lovely afternoon, lovely morning, lovely evening from Dawn and I and the rest of the Research Consortium. We're very grateful that you could join this session. We look forward to seeing you tomorrow. Adios. Ciao, ciao.
Ciao, ciao to you all.
Thank you very much.